Hello, I am recording through YouTube, and I'm hoping to be able to I'm hoping to be able to edit this. Oh my goodness! Of all times for the yard people to come today, it must be Wednesday. Anyway, I'm hoping that it's not a distraction out there. Is what I wanted to talk to you about. I've been trying for the past hour and a half to record a update on something like healthcare. I wanted to talk about that with my recent oh, and thank you for all the nice gestures and get well wishes and everything. Thank you very much. I really appreciated that. I was kind of sick. kind of I was in pain. And that's another thing with your health. If you're not well and you're not one to depend on anybody, call the ambulance, have them come get you, work with your ER doctor. The ER doctor said, and you have the most contact together. The most contact together. If it seems that you can't get the right channel to go to the right spot or anything, and it keeps like the itsy bitsy spider, but the rain doesn't come down, then that's where we have to come together like this. Every link has to connect with the link. And if that's not happening with your eligibility crisis and your qualifications and the quality of the doctors and nurses and staff and everything is not working out for you, you have a right to request other information. You have a right to say no. You have a right for other patients' requests. You're a person before a patient. I wanted to mention that with my own experience now that I had, and it was a big one, of course, that I advocate on a lot of different measures and different things. I don't miss anything. I see everything. I'm like a monk number two, so to speak, and that's sad sometimes, but I have to say something. I might not be able to hear what's being said, but I'm very visual. Okay, I can see everything. I just wanted to say that oh, sorry. I just wanted to say that with the little venture I went on this weekend and my experience that the eligibility wasn't working out in this way, and I couldn't, when the people that they referred me to wasn't accepting, and just all the confusion can really upset a person who is in need, health-wise. I don't care if it's your baby, it's your grandmother, or it's your great-grandmother, yourself, or your neighbor. If there's a need and it has to do with your health, our world is here to care for you. It might not look like that, but in the USA, they're here to care for you. They have to. By law, they have to. They might not like it. A lot of my money might not be made, but by law, you have rights. I had it experience. I had a little ventures. This is different. I'm going through YouTube, so bear with me. With the doctor, what it was not the ER doctor, not the doctor that they referred me to from the hospital itself, from the being admitted, but the floor doctor. The floor doctor was here going to say, well, well, no. There's no woo, 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 woo. No, nothing about that. You don't talk to people like that. You don't treat people like that. He acted like a little cartoon. If I would have been not as far deep under the weather and on morphine as I would have videotaped it, because it was absolutely hilarious the way he presented himself in the manner that he did. But I'm not gonna be treated with disrespect. I'm sorry, it's not gonna happen. But I do want to say that if there is any time that you are ill, and you can't for the life of you figure out how you're gonna make means to get well, take some downtime, go to the hospital, work with your ER. I found that working with my ER doctor was way better than even trying to get to the regular doctor, because that, in itself can take a period up to 30 days in an emergency event. So work with your ER doctor. He's there work with you. I was really I was really happy about that. It's not my favorite hospital that I was in, but you know, it served its purpose and it did what it did, and it got me where I needed to go for the time that I needed to be had. And you know, and I may be billed, but if I'm billed, well, then I guess I'm billed. I'm not going to sit up in pain for, you know, anybody like that. I'm going to try to help others and refer resources, the whole 9 yards, to the next person as I get it. Uh, there was an experience that the staff is caretaking. Now, I had experience with that. I took pictures of what was happening, and I showed it to the director. And she had given me some pieces of advice as well. And she had told me, because they have patients' rights. Now, always remember, you know, your patients' rights pamphlet in the hospital. Read them if you need to, because they're very important. She had said that you have, as a person and a patient, that if you don't like the results of one thing, try something else. She said, just try something else. You don't have to take one person over another person. You don't have to do that. And that's where I'm trying to hopefully educate the communities that they don't have to live in pain and they don't have to worry about, you know, getting healed and whatever. Because I'm telling you, this world has really got a lot of people in fear when it comes to our health care. We're nervous. We probably have people dying and nobody's even caring, and that's not right. That's not right at all. And if anybody's going to say something about it, I'm going to. Okay? It might not get out there very far, but I'm going to say something. It might be only talking into a microphone, this thing up here on the wall. Well, on the wall, I guess. But I'm going to say something about it. And I just wanted to let you all know that. Now, I'm going to try to see if I can edit this to where I can put some annotations or some kind of captioning to it, because you know their captioning is not 100%. So I might have to annotate a few spots for you to be able to get my hearing impaired deaf population as well. That's another topic in itself. Don't let me go there now. Okay, well, have a nice day, and I hope this video goes through this time. Thank you very much.